We are the team of mediators for Science Gallery Atlanta.
We are
scientists,
trailblazers,
storytellers,
seekers,
questioners.
We are artists.
We are Emory University students, and we are here to invite you
to join us,
to gain courage,
use your voice,
and express yourself without judgment.
Because when you do,
energy is activated,
and an upsurge in creativity is transferred.
What can happen if you access new ways of thinking and expressing?
At Science Gallery Atlanta, we are using virtual experiences and engagement
to connect and see how we can open up
and help us all cope and set the tone for the rest of the day,
the rest of the year,
and maybe the rest of our lives.
Let's be, let's act, because our ability to improve conditions happens when we come together.
Hi everyone, I'd like to thank you for joining us today for our important discussion. My name is Shayna. I'm an Emory University student and one of the student mediators for Science Gallery Atlanta. We at Science Gallery Atlanta are producing a virtual series that explores the world of coping mechanisms, the adaptive, the maladaptive, and their relation to the current global pandemic. Today, we are joined by Dr. Mathias for a discussion about substance abuse. Dr. Mathias, welcome and thank you so much for joining us to talk and engage in this discussion. Could you please introduce yourself for us?
Absolutely. Thank you for having me first and foremost. So I am Dr. Joseph Mathias. I'm an addiction psychiatrist at Emory Healthcare and assistant professor at Emory University School of Medicine. I became interested in addiction psychiatry during my general psychiatry residency, which I completed in Western Massachusetts. My local community was suffering greatly due to the opiate epidemic. The opiate epidemic did not discriminate for age, gender, race, or social demographic. I wanted to learn more about the disease of addiction, and that actually what led me to pursue an addiction psychiatry fellowship here at Emory University following completion of my residency.
What issues with substance usage have people had during this pandemic?
One study of over 5,000 people conducted by the CDC found that 13.3% of all respondents and 24.7% of 18 to 24-year-olds endorsed starting or increasing substance use to cope with pandemic-related stress or emotions. So that's nearly 1 in 4 young adults increasing their substance use because of the pandemic. Preliminary evidence also highlights an increase in alcohol use in college students. We've also seen an increase in negative outcomes from substance use, like ER visits and drug-related overdose deaths. Many of these are because of opiates. I'm seeing this firsthand in our adolescent substance use clinic, which provides care to people ages 14 and older. People are using substances like alcohol, cannabis, and even nicotine in greater amount. I'm seeing people completely new to treatment, as well as those who may have relapsed or returned to use after a period of time without any drugs or alcohol. There are a number of likely reasons why, like increasing rates of stress, depression, anxiety, and social isolation, all of which are risk factors for substance use. There's also a blurring of that line between what has been viewed as more acceptable, like drinking with friends on a Friday or Saturday night. For people stuck at home, there's just less difference between that Friday and Saturday or that Monday and Tuesday.
So how do we recognize when our substance use has become a problem?
I really encourage people to take a look at the relationship they have with the substance. Is it getting in the way of you doing well at school or work, or damaging the relationships you have with other people? Does your substance use ever put you in dangerous or risky situations? Has it caused any health problems? Do you crave using a particular substance or drug as a way to cope with feeling upset or even bored? Answering yes to any of these questions would be a red flag and possibly signal the need to speak with a physician or a mental health clinician.
So for people in my age bracket, whether that's like 15 through 24, is the substances that people are abusing, is that more alcohol and marijuana and tobacco, or are people getting into like more stronger drugs, like meth and heroin and stuff like that?
Yeah, no, alcohol, nicotine, and also stimulants are pretty big in this age group too. That that you're talking about. So, it's a kind of a whole variety of substances. So it's not one particular substance. There is a whole variety there. And, even talking about, cannabis too. I think marijuana use is becoming a lot more prevalent as well too. So it's just not one single substance.
So how do you approach a family member or friend when you're worried about their substance use?
This is a really, really difficult thing to do, especially when your family member, friend, your loved one is going through something so difficult, and you don't want to look at them or talk to them with a judging way or producing shame. So I approach this in different steps. So do some pre-work. Think about how you can approach that person with love and concern and not judgment and accusation. Role play with a trusted partner. What does it feel like to say it? When you do talk to that family member or friend, try using effective communication tools like making understanding statements and using I instead of you, which goes a long way with personal effectiveness. Describe your own feelings and reactions towards their use. End the conversation with an offer to help. Keep it open-ended. Is there anything that I can do to help? Maybe have a hotline number handy or a person that they can contact for professional help. Sometimes it doesn't go well no matter what we do, and preparing that they may not be receptive at all. The person doing the approaching might need their own support. So consider checking out community support groups such as Al-Teen or Al-Anon, which are now completely online and free.
So there are support groups now online with the pandemic.
Oh, absolutely. So, this was a huge shift once the pandemic really, really hit in March about how to make these support groups accessible to people when the risk of transmission would be very high if you were to have in-person meetings too. And the beauty about AA or Al-Anon or Al-Teen or NA or any other self-help groups is that they bring people together to offer support. And what all of these platforms, or all these self-help groups have done is create virtual spaces where people can still join these meetings at their own time, at their own leisure, in the comfort of their own home and in the safety of their own home right now too. So these supports are available, and they serve as a great resource to connect you with building and having a sober support network.
That's amazing that they're having that available to people. It's really important. So I have one more follow-up question. Is having substance abuse problem make you more vulnerable to COVID?
That's a really good question. So with substance use, right, you also do start to become a little bit more impulsive, right? Well, when you're talking about just in one example in particular, alcohol, right? If you consume a couple of drinks, you start to become more disinhibited. You might start being impulsive and doing things that you normally wouldn't do and participating in risky situations, So certainly going out with friends and being around them, sharing drinks, it can all certainly put you at a higher risk of transmission of COVID, right? Because you're in those close proximity and you're really probably not social distancing at this point. So absolutely, I think increased substance use would also increase your risk of transmission of COVID.
Everything we covered today was extremely important, and I think a lot of us out there really need to hear this. So thank you so much for joining us.
Absolutely. Thank you for having me, Shayna.